I think it's nonsense.
Who exactly will be treating us when we show up at the emergency room or at our primary care physician's office? Who's going to be left practicing medicine in this country?
We're talking health care, trying to answer the questions that we've been hearing from you. Our next guest is a member of Congress, former presidential candidate, and a doctor, oh, by the way. Dr. Ron Paul, thanks for being our guest. Did I hit the wrong line? Oh, well, my apologies. Dr. Ron Paul, thanks for being our guest.
Good to be with you.
That was a great interview, and then I blew it. You've read the Baucus bill. You're one of the few up there that would actually understand it, having practiced medicine. Should we be worried?
Well, I think you ought to be. I think everybody should be, and I think a lot of people are from the views that I'm getting lately. You know, a lot of people are very, very worried about it. So, and our phone is ringing off the line, and I asked my staff today. I said, "What's it going like?" And they said, "Well, we get no calls for any of that stuff." So,
what worries you most about the bill?
Well, two things. One, it's going to cost a lot of money, much more than they claim it won't cost anything. They're going to, raise fees and different things and stop fraud, and they're going to pay for it. But the worst thing is it's going to ruin medical care. It'll ruin medical care, and the costs are going to go up. Government has never improved medical care. All they do is pump more money into it, and it costs a lot. But all that does is push prices up. It doesn't improve distribution of anything, whether it's a service or a product. All they do is push costs up, whether it's medical care or education. The quality of education doesn't go up by pumping more money into the Department of Education. And I think it's the same thing is true with medical care.
How do they harm the quality of health care?
Well, one, it makes it a bureaucracy greater than it is now. They, for instance, in a bill in the spring, the stimulus package, they gave the authority to the federal government to control every transaction, not control every action, but to register and measure every medical transaction, everything that will happen. And in one of the bills, they had a $50 billion in order to just keep records at the federal level to make sure that doctors do the right things, that nurses do the right things, the right drugs are used, nobody ever prescribes, and you don't go to doctors too often. It's monitored by bureaucrats, and that's just very, very expensive, and it can't be efficient. So
I don't understand what your problem with that is. I mean, they do the driver's license program, and that's incredibly efficient.
Well, I haven't noticed that.
Of course you haven't. Dr. Paul, one of the issues that comes up repeatedly, and I hear this from a lot of people, are older Americans, maybe they lose their job, that may have a pre-existing condition, and insurance companies make a financial decision. I don't blame them for that. They make a decision, hey, it's not profitable to insure you. The payout would be more than the premiums we would collect. What's the solution for those people?
Well, it's not easy because first thing is that government has interfered with insurance, and therefore it's not always insurance. It's they want everybody to have insurance, but they want prepaid care, which is a social welfare program. The contract is supposed to solve this kind of problem. One thing that we don't have, because of the way medicine has been working for the last 30 or 40 years, the insurance companies have been able to benefit, but you should have a policy like somebody at the age of 20 ought to be able to buy an insurance policy that is for a lifetime, and they can't drop you. They do this with life insurance.
Right.
You get it real cheap when you're 20 years old, and they don't dump you. Matter of fact, the policy itself says, well, okay, we're going to give you this policy and it's for life. Oh, you just got diabetes, and we change it. They don't do that for life insurance. So there are some quirks in the medical insurance that has not permitted that to happen, and that's what we need. Usually when there's real competition, people will compete and try to provide a product. One thing we could do is make sure that these are all tax-deductible insurance policy. If you're trying to get away from government medicine be involved, what we could do is have individuals have the medical savings account and get everything deductible, and what makes it inefficient is when you get the first dollar paid. The routine care should be paid out of the pocket. It's sort of like car insurance is more like insurance, because you buy car insurance, it's for an accident or, a fire or something. But you don't get paid for your gasoline and your repair bills, because that causes different kind of behavior. You don't have food insurance. You don't have insurance. You don't go out from the insurance company and buy insurance and say, okay, we all want food. You might eat differently than I do. I might not eat as much. You might want to eat steak.
Right.
If we're all thrown into the insurance pool, it just doesn't work. And that's what's happened to medicine. Everybody's all in one thing. And that's come about because of our tax laws and our ERISA laws and through retirement benefits. And this is what has prompted all that. So we've gotten away from having insurance for medical reasons. So that to me would have to change if we ever expect to move in the right direction.
Dr. Paul, two issues, distinct issues that often get clumped together. Number one is quality of health care, and number two is how you pay for it, and how the fact that some people don't want to pay for it or claim they can't pay for it, and yet people want to give them some level of health care, even if it's not a good level of health care. How do you deal with the latter issue when a number of people, they'll claim they can't pay for health care, but they can still pay for the things they want to pay for, cell phones and beer and cigarettes and whatever else it is that's a higher price? How do you fix that problem? How do you solve that?
Probably not by offering free services. Maybe some people figure, well, I don't think I'm going to get sick. I'm going to try to get by. If I get sick, I'm going to the emergency room. Nobody gets charged in the emergency rooms. So when you have that offer out there, it's sort of like when illegal aliens come in, they don't have to worry about medical care, because they know that they can go to the emergency. As long as that is the case, people don't have the incentive to take care of themselves. And some of it I don't entirely understand, but I do know that I was raised in the 30s and the 40s, and my parents didn't have insurance. Nobody even thought about it. But costs weren't that high, and my parents were responsible. They would save money, and they would pay their bills.
How did the cost escalate to the point that they are now?
Well, especially since the 70s, that's when government got, matter of fact, from the 60s, government got involved, and they pushed money into medical care, and the prices go up. But there is inflation. Inflation means that, the dollar doesn't buy as much, and certain things go up faster than other things. The things that government gets involved in, those prices go up much faster. So it is tough, to pay for all these bills. But we don't have true competition in medicine either. If you had free entry into medical care outside of the licensing of every procedure, prices would tend to go down. And that is anathema to organized medicine.
What would be some of those unlicensed procedures?
Well, I don't even think, I don't like the idea of licensing for anything. I think if somebody could come to your house and you trust him, he knows how, but he happens to live in the city, they, oh no, you can't do your plumbing here, you're not a licensed plumber, or you're not a licensed electrician. Well, maybe somebody who's not a license, he doesn't have a license, he can do it just as good a job and do it for half the price, and that drives the price down. In medicine, that's the case. Why can't, in the military 50 years ago, I guess it wasn't quite that long ago, but a long time ago, we had corpsmen did all the suturing. Well, you could have clinics and people could do that, and you could have competitions. Nurses could treat sore throats. And then for the expensive procedures, the person that was not licensed could, that was, properly trained. But the other thing is you can't use fraud. You can't claim you can do something. But there's no free entry into providing anything on medical services. So there's a lot of people who are involved in keeping the prices up. The medical profession, the health industry, the insurance industry, the drug industry, the management companies, and the hospital management companies. These all have an incentive to go to Washington and try to get the regulations written for their benefit. And there's no change on that. Even with the administration, a lot of people complain, we're going to get socialized medicine. I don't think we are. That's when government actually owns and runs everything. But we're going to have a lot more of what we have, which means the corporations are going to run medicine. And this means the costs will go up, and there will be more bureaucracy, and the companies will be regulated by government, but you won't see any quality improvement.
Congressman and Dr. Ron Paul, I wish we could keep you for longer, but we promised your people we'd keep you moving because I know you have some other things to do this evening.
Thanks for having me.
Thank you for what you do.